If you're over 60 and your vision has started doing things it didn't used to do, blurring at the edges, struggling in bright light, losing words on a page, I need you to stop and watch this. Because what your eyes are trying to tell you may have nothing to do with your glasses prescription. A study published in the American Journal of Clinical Nutrition tracked 2,900 adults over 65 for 4 years and found that more than 1 in 5 had B12 levels low enough to cause neurological damage. And here's the part that doesn't get said enough. In many of those cases, the first symptoms weren't tingling in the hands or fatigue, they were in the eyes. Hello, health champions. I'm Dr. Elias Hartman. In the next 5 minutes, I'm going to show you 3 specific eye changes that can appear when your B12 is running dangerously low. Why B12 absorption drops by up to 40% after age 60, even when your diet hasn't changed, and the one supplement form that most people buy, and that most people's bodies over 60 can barely use. Before we go further, I want you to drop a comment right now with just your age. I want to see who's in this community, because B12 deficiency looks very different at 63 versus 73 versus 83. The symptoms shift, the risks compound. And if you've ever noticed your vision going blurry even when your glasses are fine, add the word foggy to your comment. Just your age, and foggy if that's you. Let's talk about what's actually happening in your body, because once you understand this, those eye symptoms stop being mysterious. Mechanism 1. Myelin degradation. Myelin is the protective sheath wrapped around your nerve fibers. Think of it like the rubber coating on an electrical wire. Without enough B12, your body can't produce myelin properly, and that coating starts to thin and fray. When that happens to the optic nerve, the one that carries visual signals from your eye to your brain, the signal gets scrambled. For adults over 60, this matters more because myelin repair already slows with age. Research shows the optic nerve can begin showing measurable changes when B12 drops below 200 picograms per milliliter, a threshold many people are sitting at without knowing it. Next, let's talk about what's happening with your homocysteine levels. Homocysteine is an amino acid your body produces naturally. It's like exhaust from normal cellular activity. B12 is one of the key nutrients that breaks it down and clears it out. When B12 is low, homocysteine builds up in the blood. That buildup damages the small blood vessels feeding your retina, the thin tissue at the back of your eye that processes light. Think of it as sediment clogging the smallest pipes in the system. A study in ophthalmology found that seniors with elevated homocysteine had a 34% higher risk of age-related macular damage. 34%. And most of them didn't know their homocysteine was elevated. And here's where it gets even more important. The third mechanism is what researchers call subacute combined degeneration. The slow, cumulative breakdown of the pathways connecting your visual cortex to the rest of your nervous system. At its earliest stages, this doesn't show up on a standard eye exam. It shows up as visual field gaps, patches where your vision is simply missing, or as a sensitivity to light that wasn't there a year ago. By the time these symptoms appear, deficiency has usually been building for 18 to 24 months. Let me tell you exactly what happens to a 71-year-old woman who comes to see her optometrist. She's noticed her vision going blurry. Not constantly, but in waves. She's had her prescription updated twice in 18 months. The optometrist finds mild dry eye, prescribes drops, and books a follow-up. The drops help a little. The blurring doesn't stop. 6 months later, she's referred to an ophthalmologist who finds early retinal changes and notes she might be developing macular degeneration. What nobody ordered was a serum B12 test. What nobody asked was, has your diet changed in the last 2 years? Are you on metformin? Are you taking a proton pump inhibitor? This scenario plays out thousands of times a week across this country, and it is preventable if we know what questions to actually ask. Now here's the part that's going to sound counterintuitive, and I need you to stay with me, because this is where most people miss it entirely. For decades, we've assumed that if your B12 intake looks normal on paper, you eat meat, you eat eggs, you take a standard multivitamin, your B12 is probably fine. But research from the New England Journal of Medicine, replicated across multiple studies since 2010, tells us something completely different. After 60, the stomach produces less intrinsic factor, the protein you need to actually absorb B12 from food and from most standard supplements. Which means you can eat all the salmon you want and your blood level can still be dropping. Most standard multivitamins contain Cyanocobalamin, the cheapest form of B12, and the form that requires the most conversion steps inside a body that may no longer be performing those steps efficiently. That gap between what people think they're getting and what their cells are actually receiving, that gap is costing real people real vision. Now, I want to be completely transparent with you. B12 deficiency is not the only cause of the symptoms I've described today. Glaucoma, diabetes-related retinal changes, and certain medications can produce similar findings. I am not here to tell you to self-diagnose. What I am telling you is that a serum B12 test and a homocysteine test are simple, inexpensive, and routinely overlooked in standard senior wellness panels. Ask for them by name at your next appointment. That's not overreacting, that's being your own advocate. What the evidence does show is that when deficiency is caught early, supplementation can stop the neurological progression and, in many cases, reverse some of the damage. Here's what you can do starting today. First, look up the medications you're currently taking, specifically metformin, proton pump inhibitors like omeprazole, and H2 blockers like famotidine. All three are known to reduce B12 absorption, and all three are among the most commonly prescribed drugs for adults over 60. If you're on any of them, that's your first reason to get tested. Second, if you decide to supplement, look for methylcobalamin or adenosylcobalamin, not cyanocobalamin. These are the active forms your body can use without conversion. A dose between 500 and 1,000 micrograms daily is the range most evidence supports for adults over 60 with absorption concerns. Third, do a simple self-check right now. Cover one eye and focus on a straight line. A door frame, a window edge, anything with a clean horizontal or vertical line. Does it look wavy, broken, or missing in places? Switch eyes. If yes to either, write it down and bring it to your doctor this week. Don't wait. You now know something that most people, including many primary care providers, don't connect until it's much further along. You know that the optic nerve depends on B12 to maintain its protective myelin sheath. You know that elevated homocysteine, driven by B12 deficiency, damages the blood vessels feeding your retina. And you know that the supplement form matters, that cyanocobalamin, the form in most cheap multivitamins, is the least useful option for a body over 60. Most importantly, you now have the knowledge to walk into your next appointment and ask the right questions, not wait for someone else to ask them for you. Your body is not working against you. It is trying to protect you. Once you understand that, everything changes, because now you're not fighting your body, you're finally working with it. In my next video, I'm going to cover the 4 silent blood pressure patterns that damage the brain overnight, and the 2 common habits that make every one of them worse, that most seniors are still doing because they've been told they're healthy choices. If this information helped you, please share it with someone you love who is over 60, and subscribe to this channel because my mission is bringing you research-based senior health information that is practical, honest, and potentially life-changing. I'll see you in the next one.